Okay, we're going on to the next type of um, therapy approaches, and we're going to start with the humanistic therapies. And just like humanistic, these type of therapies are going to focus on the potential, like the person's fullest potential, and reaching that self-fulfillment. Okay, this is an insight therapy like psychodynamic, which allows them to kind of get an insight into the person's self-awareness and this self-acceptance. Okay, they're going to focus on growth and not so much about curing an illness. They want the person to take immediate responsibility for their own feelings and actions. And then they focus a lot more on the conscious thought. Okay. They also focus on the present and future. So it's more like present time, future, and not worry so much about the childhood or the past. Okay. Now, one of the approaches that they use or therapies they use is called the client-centered therapy or person-centered. You may see them two different ways. And this was created by Carl Rogers. We learned about him in Personalities. Okay. And then here he basically wants to honor the idea that humans are like they are born to be good, right? And so here they're going to focus more on the potential. Like everybody has the potential to be their very best. And there has to be four principles that are needed for this client-centered therapy, okay? And the first one is going to be that unconditional positive regard. And this is where they're going to reinforce the clients, their values for who they really are, okay? And then they stay clear of judgment. They accept all of the traits of the patient, and there's no judgment there. Okay, the next one is that they're going to have empathy, okay, towards their clients, in which they have to be able to truly see and feel and understand what the client is experiencing without judgment, okay? And then there needs to be the third one is active listening, in which this is going to, they're going to echo, restate, and seek clarification for what the person is expressing, okay? And then acknowledge their feelings, their expressed feelings. So here they'll say like, oh, I hear you say this. They kind of like give back what the patient is saying and then, ask for clarification of anything, okay? And then the last one needs to be congruence, okay? And congruence is basically that the therapist is willing to foster an honest and open relationship with the person so that then they're modeling, right, a genuine relationship and kind of allowing the other person to see of what that really looks like in a relation, right? It's congruent, it's back, equal. Then there's going to be what's called Gestalt therapy. And Gestalt is that they kind of look at the person as a whole. So for here, they believe that troubled people have lost a sense of who they are and who their wholeness is. And so they kind of lose an aspect of their personality. So here they're going to focus on the person's perception of his or her own feelings and then own a sense of reality in the present moment. Okay. Now, the therapist would often challenge the clients to become more aware of what they're feeling in the here and now. Okay. Now, they could use the technique which is called empty chair technique. And this is where the client will have like a dialogue with a feeling or like a feeling that they're experiencing or something about themselves, like a personality. And then it's kind of like a conversations with themselves, okay? And then they could also use another technique, which is called exaggeration. And exaggeration is basically that they ask them to exaggerate a feeling or a nonverbal gesture or movement so that the person is aware of those feelings or emotions, like what's really behind that. And then, like, when you exaggerate, it kind of brings a little bit more awareness to those feelings. Okay. Now, assessing humanistic therapy. So, one of the biggest things is the lack of empirical research, right? It's very hard to get quantitative research, like numbers. This is more of like qualitative, which is just like client and therapist feedback. And so, of course, that's always going to be subjective and very much biased, right? Okay, so we're going to go on to the next type of therapy, which is going to be behavior therapy. And behavior, remember that this one is that they're going to be looking at classical and operant conditioning, and we'll talk a little bit about some of the techniques. Okay, so here they're going to look at, for behavior therapies, they're going to use behavioral techniques to see maladaptive symptoms, right? Typically like phobias or like some behaviors that are like maladaptive, okay? And then they're going to try to replace it with constructive behaviors, okay? So many times they either want to eliminate a behavior, but then they want to replace it with something else. Okay, so there is what's called classical conditioning techniques. Okay, and so we've talked a little bit about this, but this is that they're going to use classical conditioning to change a behavior. Now, many times they'll use what's called counter conditioning because people are coming with a maladaptive behavior. And counter conditioning is where they're going to pair the trigger stimulus, right? Whatever it may be that creates maybe like a fear, and then they're going to replace it with a new response that's not associated with fear. So this is where we talked about that the lady, which I forgot, that she wanted to remove the fear of somebody that was afraid of rabbits. So she tried to counter condition that, which leads to exposure therapy. Okay, and exposure therapy is basically to expose to what they normally the patient would avoid or try to escape. It's kind of like facing their fears, exposing them to what makes them scared. Okay. Um, so there's different ways of doing that. You just can't throw somebody in there, even though that is a way of doing it. So there is what's called systematic desensitization, and this is typically the one that they used for exposure therapies. And it is, we talked about, it's kind of like a hierarchy of what makes the person anxious of the thing. So they'll create a hierarchy of anxiety that triggers like the triggering situation, okay? And then they'll slowly, like as they go, they slowly start at the bottom and work their way towards the top till there's no more anxiety, right? So they'll start at the bottom, repeat, repeat, repeat till there's no anxiety. Then it's time to move to the next one, okay? And this will take obviously a lot of sessions depending on how bad the fear is. There is also they're using now, which is called the virtual reality exposure therapy, and this is they're going to use virtual reality to try to expose people that are in that like a life-like scenario. Okay, so this could be from flying, from heights, maybe even animals, maybe public speaking. This works really well with people that have social anxiety. They could definitely put them in a like virtual reality scene. Okay, now there is also another strategy that they use or technique, which is called flooding. Okay, and flooding is basically where they're going to fully expose the whatever the stimulus is that creates the anxiety in a harmless and controlled situation that the person cannot escape. Now, obviously, this is, they better choose wisely, because if the person, it's too much, the flooding, then they could have, a panic attack or go, regress back. So try not to do that as much, right? It has to be really safe. Then they have aversive conditioning, which is basically substituting a negative response for a positive response to a harmful stimulant. Okay, should I write that down? So it's kind of like they're creating an aversion to something the person should avoid. So this could be something like nail biting, alcohol abuse. Okay, they'll typically do something like put something like in the nail thing or in the alcohol that makes them sick, so they don't want to do that. Okay. Now, this one's not as effective, by the way, which is the aversive conditioning. All right. Then there's the operant conditioning, which this is more of the B.F. Skinner. This is the reinforcement and punishment. Okay. And then here they're going to use what's called behavior modification. Okay. And which they're going to reinforce the desired behavior and withhold reinforcements from the undesired behaviors, right? So reinforce the behaviors they want and then stop reinforcing the behaviors they don't want, okay? They're going to use positive reinforcements to shape behaviors in a step-by-step manner. They're going to typically reward closer to when the desired behavior is happening. Okay. Now, the rewards, they can be attention, they could be praise, they can also use what's called token economy. And this is where they're going to, when the patient exhibits appropriate behavior, they'll receive a token or a sticker, and then they get to exchange that token for something of a reward, okay, that has value. So the stickers, like the token has no value, but it has value in getting them something they want. So they got to work for it to get what they like. So this can be, stickers, like tally marks sometimes, and then if they have 5, they get to watch TV or something like that. Okay, now assessing behavioral therapy. Now, this one typically is used a lot more often because it's quick, it's efficient. They're dealing with certain behavior problems, especially if that's what they're focusing on. It's really effective with treating anxiety disorders and children with ADHD or people with ADHD. And there is a little bit more empirical research when it comes to this one. Okay. And then the last one we're going to look at is cognitive therapies, okay, which cognitive has to do with the person's thoughts, okay? And for here, what they're doing is they're trying to teach the person new and more adaptive ways of thinking instead of the maladaptive behaviors and thoughts, okay? And they focus on, because they believe that the person's thoughts, the patient's thoughts, are intervening with their life, their events, and their emotional reactions. Okay. And so one of the ways that they do that, the type of therapy, is called rational emotive behavior therapy. Okay. And it is from this guy named Albert. I'll write his name here. Albert Ellis. And this one is kind of controversial, but this is a type of therapy that is very confrontational, cognitive therapy, in which they're going to challenge the person's illogical and self-defeating attitude and assumptions. So they will like kind of be in their face about it, of what the person, the way that they're thinking. They're a little bit like they challenge them. Okay. And so that's one way of doing it. And then the Aaron Beck's therapy, okay? And this one is basically where they're going to kind of reverse the client's, like, these catastrophic beliefs that they believe about them and their situations by using more gentle questioning to reveal like irrational thinking. Okay. And then from there, they're going to persuade the person to like remove those more negative thoughts in, and then kind of replacing them with more effective wordings or thought process. Okay. So they're very much about kind of questioning the patient, and kind of seeing like the way that they think is kind of like, and then changing it. Okay. And then there's the cognitive behavior therapy, a lot more common one that is used, which is kind of like a combination of cognition, which is our thoughts, and the behavior. Okay. And this one is that they believe that if you change the way the person thinks, then they will change their actions. Okay. And so they want the patient to become aware of like these negative thinking, and then replace it with new ones, and then practice more like positive approach or behaviors, like more adaptive behaviors, in their daily life. Okay. And they believe that a behavioral change is addressed first. So many times they focus on the behavior, and then they believe that the cognition would follow. Okay. Um, this is really good for people with anxiety, with mood disorders, okay, because it helps them kind of replace their like really catastrophic thinking with more realistic ways of thinking, more on a um, I don't want to say just positive, but also like realizing, because if people with anxiety or mood, they're kind of creating um, this like really kind of over fearful, like irrational ways of thinking. This is more kind of like letting them see, like, hey, this is what you're thinking, let's replace that. And then it also affects the behavior. Okay. And then assessing cognitive therapy is, oh, and another thing, the cognitive behavior therapy is also good for treating people with OCD, because they'll work on the compulsive behaviors by replacing the obsessive thoughts too, right? So they work hands in hands with that. So assessing cognitive therapy, it's actually very cost effective and cost efficient. It's a very good therapy and approach to work with multiple different disorders out there, which is why it's the most common one out there. All right, and that is that for this little section.